So to give the punchline, both the cause and the cure for addiction resides in the need and drive for wholeness. Period. So the cure and the cause are within, and we can see slowly that there's an alchemical process when you hit rock bottom that can be a transformative experience, facilitating growth. I'm talking about the meaning of life, which is soul evolution. So if you can alchemize this, then that's where we go. So let's give it a shot. We can get an advancement here. There we go. Today we're going to talk about addiction as a disease model. I'm going to present to you the typical academic perspective that I was taught. We're going to go into some therapeutics briefly, look at trauma, we're going to look at psychedelics and spirituality, and I'm going to come from not only a perspective that I've experienced, but also one I've researched, one that I have seen in other people, and one that may be controversial. But what good is it if you don't ruffle feathers here and there, right? So addiction, dis-ease, lack of ease or comfort. And when we look at the disease model, we're looking at the effects of drugs on the brain, period. How the brain works with drugs, how the drugs change the brain, how the changes of the brain control behavior. This is what I did for 15 years. This is only part of what really matters. It's not the cure. So what is substance use disorder? So we're going to use SUD, substance use disorder, DSM-5. But it's basically the clinical term for addiction, chronic relapsing dis-ease of the brain characterized by loss of control over intake, decreased drive for natural reward. So now the drug's replacing natural reward, and you increase relapse vulnerability even when you haven't used a drug for long periods of time. You can go a decade. Philip Seymour Hoffman, one of my favorite actors. We'll talk about how neuroplasticity comes in with that abstinence and then going back and using the same amount of drug. DSM-5, I think they're working on DSM-6. This is the Psychological Diagnostic Manual for Mental Disorders. And they characterize SUD as recurrent, significant clinical functional. So it's impairing your life, basically. You're having problems in your life. It has a scale. It can be mild to severe. And it combines abuse and dependence into one substance use disorder category now. So basically a blanket umbrella, substance use disorder. And they replace legal problems with craving, which is an important, because we're looking at the physiological response. So you can kind of think about how the DSM thinks they're being ahead of the curve with replacing craving with legal problems. But within a structured system, it takes decades for the changes to trickle in. So let's poke the bear with the stick a little bit. We can do this. Here we go. This is just saying it's an acquired disease of the brain, meaning that, yes, the initial voluntary action to take a drug is a voluntary action. But it becomes acquired in that you lose control, it affects the brain, and I'm just going to show you why it's a disease. And this is just showing you that relapse rates are similar to other health problems that you have. You have type 1 diabetes, hypertension, asthma, so it's within there. The majority of people who try a drug do not become addicted, right? We've all tried drugs. So the majority do not become addicted. And then this is more of a societal slide where I just make a plug to reduce stigmatization. Because it's very harmful when you look into someone's eyes and you refer to them as an addict. When you see shame in someone's eyes. There's no room for shame in this world. When you're searching for wholeness and bliss within yourself, how dare you shame someone for that? So, I always encourage using substance use disorder instead of addiction, which I will use addiction interchangeably for the purposes of the talk, to avoid calling someone a label such as an addict. Yes?
What would you do for someone that has an addiction or dependency to something that isn't a drug?
It's the same thing. It's just
Yeah, but what would you call it? I guess is what I'm asking. What language would you use?
well, I have to think about that. I'll get back to you on that one at the end. There's many different approaches to that. So you could replace substance with something else. The word substance with another factor, basically. Use disorder of some sort. So avoid triggering terms. So when you use substance, it's less triggering. Drugs can actually induce craving. Drugs. When you associate the term drugs with dopamine, you're like, yes, give me some more of that shit right now. That sounds good. Let's turn that physiology on. I'll minimize swearing, but every once in a while it's okay. I learned that at the university when their students were nodding off. You drop a little bit of a swear word. They're like, wait a minute, I heard what? So addiction, substance use disorder is cyclic in the sense that you get a good feel good, then you don't feel good anymore, then you want to feel good, and it creates a cycle. So what drives this? Well, obviously you have a plethora of things. And this is, keep in mind, this is the academic traditional approach, and then we're going to go into a different one. You have genetics, you have the effects of the drug, and you have the environment, and together they interact. And really, how can you pinpoint the cause of something that's this complex and integrated? Comes down to wholeness again. Why do they take drugs? To feel good. So what do positive reinforcement is going to increase the likelihood of doing it again because it feels good. And when it feels good, what they've pinpointed is an area in the brain called the nucleus accumbens. It's in your limbic system. And when people say dopamine, 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 they're referring to an increase of dopamine usually at a clinical level in this area of the brain called the nucleus accumbens. And they're just looking at, you can think about the colors from low to high. They're actually just looking at receptors, which is an indirect indicator of the neurotransmitter, so you have to be very careful of how you look at that. You're looking at basically low to high. So red's high expression. I'm sorry for the cameraman over there. I'm going to keep him working.
My fault.
There you go. So just to give you an idea of the neurocircuitry of addiction. This is the main circuit that has been studied. And it's the mesocortical limbic system, meso being midbrain. That's the ventral tegmental area where the dopamine comes from. Meso. Cortico, cortex, prefrontal cortex. Limbic, nucleus accumbens. And we don't have to get too far into this. You can basically think about it as a circuit. And that circuit itself facilitates the reward, the feel good. That part of your body that feels damn good when you use something. This is one of the main circuits that allows for that to happen. Everything's connected. So once you tweak one part, it all adjusts. It took me 15 years to figure that out. So when we start manipulating intracranially, what good is that clinically when everything else adjusts? So we need more of a holistic approach. Substance effects, neuroplasticity. Brain changes function, like Play-Doh. Drug-induced or substance-induced neuroplasticity. The brain changes function as a result of being exposed to drug. And this comes into the Newtonian physics of for every action there's an equal and opposite reaction. So I'll show you evidence for this unfortunate physics law sometimes here in this world with regards to when you feel good, you feel bad, yin and yang pendulum swing of addictions, of substance use disorder. But ideally, in other realms, proportionately balanced would be a better response than equal and opposite. So if we can target a proportionally balanced response instead of equal and opposite, then you have less of a pendulum swing and able to find that neutral point. And that's something that we need to take into consideration. The theory behind addiction needs to change in order to treat it. So for equal and opposite, you do a drug over time, you don't get the same effects anymore. You don't feel as good. You have to take more and more. And it's a switch from feeling good to avoiding feeling bad. It's from positive to negative reinforcement. You feel good, now you're just taking it to avoid feeling bad. You no longer get to feel good, right? Feel good's gone. So this involves tolerance and withdrawal. Tolerance, you just have to take more of the drug to get the same effect. Withdrawal is when you have negative side effects when you don't have the drug, because now homeostasis, maintaining a particular optimal state, your body's always adjusting. So now it gets used to the drug, and you're not really supposed to feel that way because it's super physiological, meaning it's not at the normal level of stimulation for the body. So then you get that going on. And this is where if you go 10, 15 years without taking a drug and you go back, you fall into the same environment and you take the same amount of drug and you no longer have tolerance, you die. Philip Seymour Hoffman, right? You die. You overdose. But you're going to go for the optimum euphoria. You're going to go gangbusters for it. If you've gone that long, you're going to be like, I'm going to try to do that. You know, people who've done heroin will say you can try to chase it, but it's not going to be better than the first time you ever did it, ever. So this is just showing basically that the amount of dopamine in the nucleus accumbens decreases when you have substance use disorder, producing hypoactivity or decreased dopamine in the brain at normal states. And now the only thing that activates the brain itself is drug to feel normal. So now you're using a drug to activate the brain to a normal level of function, basically. Because you're no longer feeling good. So that's just neuroplasticity in a nutshell. It happens for everything. I can make the argument, I think alcohol, probably one of the more devastating drugs out there. My drug of choice when I was a workaholic. Okay, so that's dopamine hypoactivity. And then craving, hypofrontality, decreased function of the cortex. So this is normal. This is a person going through substance use disorder, and you're looking at activity. There's a cocaine-related interview and a neutral theme. Now only the drug-related stimuli activate the brain, whereas neutral themes and interactions aren't. So now the prefrontal cortex is streamlined to responding to drugs over natural things. So now it's being entrained to focus on the drug itself as what the life starts to revolve around, right? This is where physiological indices. This is not the cause. This is just monitoring. This is a symptom of addiction. I want to make that very clear. Neuroplasticity of the brain is a symptom. Symptomology. Negative reinforcement, so we talked about equal opposite, that you have reward and then it's going to recruit an anti-reward system. This is what I studied. And basically, you become more reactive and emotional. And you have a recruitment of your emotional part in memory, your amygdala. You have all these different 11 other hormones and neurotransmitters involved, but long story short, the stress system becomes recruited. And at a normal state, your stress system's at a hyperactivity drive. So not only now do you not get as much reward, you're stressed out, and you're spiraling out of control at a physiological level. And this is just showing activation of that particular part of the brain, the amygdala, involved in emotion and memory, that's activated as a result of drug-related stimuli. So it's being recruited. So if we could summarize everything up to this point, the way the brains change function of the way the drugs change function of the brain, you produce a perfect storm to drive addiction or substance use disorder. You have decreased reward, decreased dopamine, decreased frontal cortex function or inhibitory control. So now you can't control your behavior as well. You don't feel as good, you can't control your behavior, and you're emotionally reactive. Tell me that isn't a perfect storm. And anything such as cues, stress, drugs themselves, substances, all of them can produce craving that then creates this storm. So treatment. Some of the clinical treatments, if we do a normal system, the structured system, pharmacological intervention to block the craving, to feel good, to feel bad. Cognitive behavioral therapy, intervention programs, reinforcement of behavior, and abstinence. Those are the treatments. Abstinence, critical. This is just a slide showing you that with abstinence from methamphetamine that you can actually get back to almost normal levels of control of the dopamine system with time. That over time the system will adjust back, which is an important aspect of the brain. A lot of people would make the argument, we don't know if it's permanent, this or that. Well, nothing's permanent in the material world, is it? Or else it wouldn't have change. So this is an interesting slide. Let's throw drugs at something. This is what we do, right? We have a cycle of addiction. We target different parts of the cycle. Feel good. Let's block them from getting high. Let's block them from feeling like crap. Let's block them from wanting it. But if dis-ease is in fact started at an energetic level, and it goes from energy to physical matter, including chemical, how do you expect to treat addiction at a material level with chemicals? It's not going to happen. Yeah.
Sorry. Do you think they're useful tools or just?
They are under the right circumstances. You can die from withdrawal. Absolutely. They're useful tools used in moderation. In conjunction with a holistic perspective, absolutely. But it's not the silver bullet we're trying to search for.
Because they have side effects too.
They have side effects, yeah. And everything is adjusting, right? So we're just moving the pendulum around. We're just moving target. It's just a moving target, and then you wonder why they're not stabilized. Put them in the rainforest with a fast and a cleanse, an abstinence, and allow the body to adjust back to a homeostatic state. That would be much more effective because you go back to balance. So cognitive behavioral therapy, we know what that is, and that helps with executive function of the cortex. Very effective. Contingency management, you reinforce desired behavior. And when they do something wrong, such as using drugs, you withhold something, positive and negative reinforcement. One of the most powerful things you can do right now is community reinforcement. Connection. Connection. When you have a structure, and you have love, and you have connection, that's going to help. Okay, so heart-brain coherence, just going to briefly touch on this. That's basically the heart connecting to the brain. The heart sends more connections to the brain than the brain does the heart. What does this mean? It basically means that in order to function optimally, physiologically, we want to engage the heart with our nervous system. We want our heart to drive signals to our brain to allow us to flow. We talk about being in the flow state, right? Flow state. It's coherent. You don't have to think. Michael Jordan on a buzzer beater, right? That's flow. And the whole is greater than the sum of its individual parts, and it involves connectedness and wholeness. And there's techniques involved that are really important here. Heart Math Research Institute, and there's plenty of things going on there that are very efficient. This helps with a decrease in reactivity as well. So that's a promising target. Trauma. We live in a traumatized society. Everyone has trauma. It's just a grading of how much you have. It's one of the main fundamental causes of substance use disorder, mental health problems, and even EMDR, eye movement desensitization and reprocessing, is utilized for trauma, but it's been underutilized for addiction because of the lack of connection with trauma and addiction. But there's evidence, one of the few articles that I found, that can actually say that EMDR trauma treatment is effective against substance use disorder, showing that there's a trauma underlying there. In consciousness, we're going to tap into this a little bit deeper. Increased self-awareness, mindfulness techniques, meditation. Expand the consciousness, and we're going to get into this. Transcendent state or beyond the self. Beyond the self. Low S, little self. Empowerment. Delicate balance of self-empowerment. Take away the stigmatization and empower them. Releasing to a higher power, we talk about that. But why? Why is the 12-step program effective for some and not others? I was forced to do that at one point. I can tell you why. Another day. But I'll be working with people who have been court-ordered, and that's my next calling, is I'll be working with people who've gone through this. And I want to make sure that we make it something very clear, that the symptomology, what I just showed you, that's how we were researching it. That's how we were looking at addiction in academics. It's progressing, yes. But what's being reinforced? Looking for consciousness in the brain is like looking inside a radio for the announcer. Okay? We're little satellites, aren't we? We're little antennas. Looking inside. Not that kind of looking inside. That's not what we're looking for. Brain and mind, I just want to make a few different discrepancies, some distinctions. Thank you. Brain itself is a soft nervous system organ within the skull that functions as the coordinating center of sensation, intellect, and nervous system activity. That's from the dictionary. So when in doubt, I just went literal. Let's just do literal dictionary. Mind, because there's so many nuances in context. Mind is a combination of your brain and eternal consciousness. You're not going to find that in a dictionary, though. Eternal consciousness. That's the difference between the brain and the mind. Consciousness equals energy. All is energy, all is mind, all is consciousness. Everything's energy, right? We're entering that phase where we're going to have to reapply and relearn this. So if energy can neither be created nor destroyed, and we are eternal consciousness, how is that not spiritual? We have three brains: the head, the gut, the heart. Let's just open it up now. Eternal consciousness works through and expresses itself in resonance and energy expansion and contraction through processing of these organs and these brains. Temporary holding point, so we can experience the material world. So in addictions, there's a good group looking at heart-brain coherence, which has been able to strengthen the emotional self-regulation, synchronize the physiology, resilience, and greater connection, and relapse prevention. So that's one thing we can look at. Another underutilized tool where you're facilitating heart-brain coherence to treat something that is at a material dysregulation. We're treating ourselves like machines. No longer can we do that. And so a lot of this next upcoming material came from the Master's series, an Imagination and Addiction edition. Wonderful series. Give them a plug. Credit where it's due. Dr. Garber Mate, Addiction and Trauma, and Dr. David Nutt, Addiction and Psychedelics. And we're going to go and touch in on trauma and the sense of self. Addiction is an attempt to solve a problem. Addiction is not a disease. It is a doomed attempt to solve a problem. It causes a disease. What's the damn problem? Trauma. You have emotional responses to deeply distressing, disturbing experiences, which we typically relate to trauma. Combat veterans, right? But what about wounding? When your needs are not met, or this is misattunement according to Dr. Garber Mate. Misattunement is when your emotional needs are not noticed, reflected, or met. Empath-narcissist dynamic. Has anyone experienced that? Okay. And for sensitive children, or lack of attunement can be very wounding. And as a result of the wounding, become more sensitive. What about emotional pain? It's a craving for pleasure, for short-term relief, leading to long-term problems and an inability to give it up. The cause can be all states of emotional pain. It's not why the addiction, but what is driving their pain. This is a compassionate inquiry developed by Dr. Garbamate. It relieves shame, removes shame. It's not their brain circuits, but their lives. The brain circuits are symptomology. So epigenetics talk about their lives, conditioning, epigenetic overlay, study of heritable changes in gene expression, where you can have activation or inhibition of genes, and it doesn't necessarily involve the DNA sequence. Phenotype is basically the external expression at a physical level, and genotype is what's happening at the genetic level. But then your environment can change how your genes interact. They can be turned on, turned off, and they can be transmitted through multi-generational aspects. So what you get exposed to in a particular life can be transmitted to the next generation at a genetic level. Anyone else think that trauma does that? Okay. And this is key to forming personality, your sense of self, your conditioning, your belief systems about the nature of reality. What if we can shatter that? And if any other questions?
Shatter in a good way.
Yeah, in a good way. Conceptually. Yeah, conceptually. We're talking about, yeah, not in the traditional sense. We're talking about structure of how we're relating to it at a cognitive level, cognitization of it, the mental construct. So what I was thinking, we're referring to was the mental construct of it. So if we can change our perception, our perspective. Thank you for the clarity. I wanted to make sure that's clear. YouTube land, better make that one clear. What if we can shatter your life? That was already shattered. So there's different ways you can see different external stimuli in the world that come in, they interact with your genes, they can tag something, and then they can either open it up or close it and make it responsive, active, or inactive. It's not a molecular biology course, but this is just some general mechanisms of how epigenetics works. Not to mention what we're considering junk DNA isn't junk. So we're going to, in future generations, we're going to understand that it all has function. In fact, miraculous function. So trauma and addiction circuits don't develop properly. So while this is still Garbamate stuff, they don't develop, and then they produce an addiction-prone personality. And that involves emptiness, a sense of deficiency, shame, and inability to be alone with the pain. And addiction is not genetic. It's the genes that they're finding was argued by Dr. Garbamate to code for sensitivity. So sensitivity. So let's just, so these are really key points that need to be implemented. And that's why I'm putting them here. And it's not anything except his genius and compassion. It's really, he's driven by compassion. One of the most compassionate people I've seen. Okay. See if we can advance here. There we go. There's a social perspective to addiction, and we're seeing deaths of despair. National Institute of Health was really interested in this, globalization of addiction. And that perspective doesn't deny the individual vulnerability differences between the positive social determinants and being more powerful, but the cause between these different perspectives is a globalization, free market society, and capitalism. What is that doing? Socioeconomic stress, producing individualism and competition, separation and pain. It's producing separation and pain. This is one of the reasons our society is traumatized. Despair, need to fill an inner void. We have a void. Opposite of addiction is connection and inner peace. Wholeness. Wholeness. Psychedelics and addiction, part 3. So drugs produce a biophysiological effect. Medicines treat dis-ease. Addictions rooted in trauma and unresolved emotion. And so if we look at it this perspective, I'll make the argument that psychedelics are both a drug and a medicine. They do produce a biophysiological effect, and they can treat disease under a set setting, providing insight and learning under their appropriate conditions. But I have to ask you a question with psychedelics. It helps you move beyond the conditioned personality to touch the true self, to treat disease, sure. Context, set and setting. It's got to be set and setting, very important. Even my hippie father would tell me that. Thank you, Dad. Focus needs to be on integration, not the experience. So I ask you, if you take a psychedelic, are you altering or are you entering altered or transcendent consciousness? How do you discern the difference between altered and transcendent consciousness? It's a big difference there, isn't it? You know how easy it is to get lost in the experience of altered consciousness and thinking you're integrating transcendent? Transcendent. And do you need drugs necessarily to do that? You don't. But it can open you up to get past some of the trauma, but then you're open. And are you in a set and setting? What are you opening up to? Okay, not all drugs of abuse result in detectable increases in dopamine in man. What? It's not all dopamine? Damn it! Thought I had it cured. Beyond dopamine, dopamine mechanisms have failed to treat addiction. Dopamine is protective against addiction because you don't have to compensate for it. There's other roles involved with dopamine. Habit and impulsivity, they're all linked. Not just reward and feel good. Here, let me take this thing and fly high on the dopamine train. Yes?
What does that mean, dopamine is, what was it, can you go to that last slide? Dopamine is protective against addiction?
That when you have a certain level of dopamine in your system at a natural level, you're less likely to need drug. So if you have less dopamine, you're more than likely to search for a compensatory increase of dopamine. There's other paths, neurotransmitters. You have dopamine being, of course, yeah, we have pleasure and wanting, yes, but we have GABA inhibitory, so it shuts parts of the brain off-ish. Glutamate, so this is involved in memory. You have endorphins, pain reduction. Serotonin for meaning, self-control, sense of self. But we're looking at endorphins being released as well in that neurocircuit. So there's a role for endorphins. And endorphin blockers are good at treating addiction. What are endorphins? I'm not going through this. But basically, they're endogenous, natural, occurring opioid peptides and receptors. So it's a natural analgesia, pain reliever, reward part of the body, basically. So if we look at psychedelics and serotonin, we have mescaline, we have psilocybin, we have Amanita muscaris, we have LSD, we have ayahuasca, ergot. Everything across here except for Amanita muscaris. GABA, man, that's a wild ride if you mess with GABA too much, right? But what you can kind of see here is a real case-sensitive point in serotonin receptors being activated. It works through serotonin in the brain. Here are serotonin receptors, specifically the 5-HT2A, within the cortex. Look at all those receptors in the cortex designed to be activated. And within the cortex, we have something called a default mode network, and that encodes the sense of self. Talk about the cortex. Different parts of the cortex are connected. And that connection and activity allows you and gives you that sense of who you are, that sense of self, that Jordan, right? That neurological imprint. the false complementary introduction. Right? That's the little s. The greater default mode, you have basically, in depression, you have a connectivity issue where you have rumination. You have over sense of self. Psilocybin is effective in treatment-resistant depression. Well, that's great. Excellent. So now we're looking at the default mode network. So one of the things I want to just make clear is that we're going to use the default mode network connectivity and activation. They're different because that's going to be a material indices of the sense of self from the neuroscience data I'm going to show. But it's just that. It's material indices symptomology, but it gives us an idea. What about brain connectivity? Psychedelics do produce neuroplasticity and they increase brain connectivity. And I asked the question, well, is it increasing the sense of the little self or the increase of the bigger self? And we're going to go into that. And interestingly, education decreases global brain connectivity. So keep that in mind. So connectivity is important. That's just basically how hardwired globally your brain is. When you go into education, you have a few circuits that are just hammered in. A few circuits, let's make those ones that we really want really strong, and all the other stuff, we can just throw that out. Spare parts. Like, you don't ever want your mechanic to stay in your car at spare parts. So, DMN and addiction. Default mode network and addiction. It's not connected normally, and it's facilitated with craving and relapse. You have increased activity, but decreased connectivity. So connectivity. Increased sense of self, decreased executive function, and it's engaged and recruited during the substance use disorder process at the expense of executive control. Nora Volkow is the director of NIDA, the National Institute of Drug Abuse. Now, part 4, addiction and spirituality. How do we connect the dots here? Brand new, hot off the press. Had nothing else to do in the cabin. Just kidding. We all have something to do, right? Okay. So we want to take the spiritual life as part of the human essence. It is a defining characteristic of human nature, without which human nature is not fully human. This is Maslow. Maslow's hierarchy, introductory psychology. Where was that on the Maslow hierarchy? Okay, way up there. So we have biological, we have psychological, social, and spiritual. Okay, we need that component. Biopsychosocial spiritual model is a holistic approach that acknowledges the interaction between the physical, the psychological, the social, and the spiritual aspects to patient care and patient well-being. And then we're going to go into what is a spiritual. All my clients, it's whatever it is to that person. What if I were to make the argument that drugs don't give you reward, they temporarily show you your true state of bliss? Satchitananda, yes. Existence, consciousness, and bliss. Your true origin. So why wouldn't people be searching for bliss? It's your true state. Right? Satchitananda, and being, existence or being, consciousness and bliss, your true nature, unconditioned state is bliss, ananda. And it leaves it only sometimes more and less evident. But drugs do not produce bliss. They temporarily reveal your natural, blissful state. You tell someone who's suffering from substance use disorder that, when we think about that, that's my natural state. How do I get the right dose every time? Perfectly balanced dose. I have to deal with all this garbage I'm dealing with. How do I get that perfect balanced state of bliss? If it's my natural state, what's blocking me from my natural state? Behind every craving is a thirst for transcendence or wholeness. Controversial figure, yes, I know. But it's okay. We can put a white guy with a cigar pipe up there, right? But we're diversifying. Now, this is a very important definition. Spirituality has been defined as the experience of conscious involvement in the project of life integration through self-transcendence toward the ultimate value one perceives. Sandra Schneider's very famous professor. So I highlighted integration and transcendence. So if we look at that definition of spirituality, spirituality defined. And this is for context and reference point. So there's difference. So if we could just follow with me here, this is for just context, so I can relay information under a context of information for a reference point to understand the material. It isn't necessarily, I think, what I'm presenting is truthful over other things. Integration, to bring together multiple parts to function as one. Transcendence, to rise or above or go beyond limits. So with soul science, I've defined spirituality as working towards synchronizing the many parts of the self to go beyond limitations and boundaries, to find more wholeness, and as a result, unconditioned, true state of bliss. That's how I define spirituality. Central to this approach are the meaning, purpose, and core values of the individual, meaning that spirituality is specific to each and every person. It doesn't matter what another person thinks or feels. It has to be felt within that individual, and the dots need to be connected and felt. You can't even think your way through this. It's not going to help. You have to feel it. Thinking isn't going to get you through it. You have to feel it. It's got to be, ah. But I just had this aha moment, and I tried to call my parents and explain it to them, and they said, oh, yeah. But you're like, you're totally deflated where I was at. Why did it deflate where you were? Because you felt it. They heard it. So in this view, spiritual is a broad term that can be applied to any aspect of life. That's what is important about integration of science and spirituality. There is no separation and never was. It's an illusion. Many people know this. Many people feel this, but let's just get more people out there. Get more people out there, wherever this goes. Online, welcome. So again, sense of self, activity of that circuit, and dysfunction and addiction involves all these different transmitters. An increased sense of self relieved by drug use. Might be a repeat. Where am I going here? Here we go. Okay, good. Meditation, the transcendent state beyond the self. Meditation increases neuroplasticity of the reward circuit, results in joy, activation of the cortex and nucleus accumbens. So what is that going to do? It's going to help treat the decrease in dopamine as a result of drug use, as well as increase activity of the prefrontal cortex, hypofrontality and hypodopaminergic activation. So decreased dopamine, decreased cortex function. Meditation helps change the neuroplasticity of the drug. So the neuroplasticity of the drug produces decrease in dopamine, decrease in executive function of the cortex. Meditation does the opposite of that. Increases dopamine and increases executive function. So we should be saying, well, you need to learn how to meditate. And someone who's going through withdrawal, that's hard to do, isn't it? But that's one approach. So meditation with the activity of that circuit, and increases connectivity. So connectivity, you can have decreased activity, but increased connectivity. So you have increased connectivity, decreased activity in the sense of self as a result of meditation. So your brain's more connected. You're going the opposite of scholastic induction and imprinting, indoctrinization, aren't we, when we meditate? And we decrease the activity of that circuit, and we decrease the sense of self, lower S. Longer but permanent. Meditation takes longer to achieve these effects with the brain, but they're more permanent. Versus psychedelics, which is short, impermanent, and you don't know whether you are in an altered or transcendent state of consciousness. And you're open. What if you were safer meditating? Not meaning that you have anything to protect yourself from, but you're more like a autonomous, sovereign being made of energy in material form that allows you to get the most out of all that you can be. So again, mental and substance use disorders caused by trauma, inhibited wholeness or spirituality, I'll use those interchangeably sometimes. Trauma, we have turmoil and trauma is one of the greatest triggers for spiritual awakening processes, including prolonged bouts of addiction and grief. Addictions can lead to a spiritual awakening. Grief can lead to a spiritual awakening. So what can inhibit spirituality or wholeness can paradoxically also facilitate long-term spiritual transformation. So this is work by Steve Taylor, looking at a set of 90-something awakening experiences. This was first saw this at Integrated Mental Health University. Alchemizing Addiction, a wonderful unit. Check that out with Emma Bragdon. Plug for you, Emma. How are you doing? He looked at all these and they categorized it. Psychological turmoil, number 1. Bereavement, diagnosis of cancer, addiction, intense stress or depression. Number 1 for an awakening state experience, cause of an awakening experience. 2nd, nature. 3rd, spiritual practice, meditation, prayer, and yoga. 4th, spiritual literature. 5th, love and sex. Tied for last, performing arts and psychedelics. Last, psychedelics. I'm sorry, Ashland. Not that I'm anti-psychedelic, I'm not. I had a hippie clinical psychologist father, trust me. We're okay. It helps you get to this point. What am I saying, right? But let's keep this in consideration and context. You're more likely to have a spiritual awakening process from turmoil than you are psychedelics. This is the difference between altered and transcendent. Right here. So psychedelics result in only temporary dissolution of the little self and relatively low rates of permanent transformative awakening experiences, according to this study. Let's poke a bear and ruffle some feathers? Yes, let's keep it going. Psychological turmoil of addiction is more likely to cause a permanent transformative awakening experience than psychedelics. And we are seeing increased psychological turmoil and increased awakening experiences in our world right now, are we not? We are in the middle of a collective consciousness evolution, and many smart people have suggested that the trauma is a driving force behind this. May not necessarily be that case, but when things get bad, you got to adjust. We need to get rid of separation and find connection. Fragmentation replaced with wholeness. So Steve Taylor, you can find his information. That was his study, and he's got a brilliant mind and a brilliant alchemical approach to addictions and spiritual processing. Transformative awakening experiences result in dissolution of the sense of self and integration into wholeness with a new higher functioning self that was latent and waiting to emerge. A higher functioning self that was latent, incubating, waiting. Who here feels like there's a higher self waiting to emerge? What about life? Is that part of soul evolution, trying to find that higher self to emerge? This is what I call the little self to the big self. Transitioning from the conditioned epigenetic overlay self to the bigger connection cosmos self, where you are a radio receiver, but you are the consciousness coming into the radio receiver, not the radio receiver perceiving itself, not the radio thinking it looks good in a mirror. Spirals within spirals. Kundalini is the most disruptive, energetic, long-term, and transformative awakening experiences. Kundala means coiled, as in a spiral or spiral motion. If you want to attribute it to a stake, that is your prerogative. Psychospiritual, cosmic, invisible, intrinsic, and vital consciousness energy field to all of life. Let me repeat that. Kundalini is a psychospiritual, cosmic, invisible, intrinsic, and vital consciousness energy field to all of life. And is involved in the integration of the higher dimensions of consciousness, the bigger self. What cannot be fetally integrated into your DNA is stored at the base of your spine and released upon awakening. Biospiritual evolution in consciousness. Gets a lot more complicated rather quickly, but that's just how I boiled it down. Kundalini ascends, clearing trauma, opening vortices of consciousness, or chakras, eroding and dissolving conditioned self and ego epigenetic overlay. Little self to big self via energy consciousness-induced neuroplasticity. I managed to even find a research article suggesting that you have increased DMN, or sense of self, connectivity with Kundalini, but not activation. Connectivity, global connectivity, not activation. So you can read an article and say, oh, this is the opposite of what I thought it was, because it's increased activation. You got to just connectivity versus activation. You have GABA, inhibitory neurotransmitter, that basically decreases activity, but can facilitate a global connection and raise things up in resonance of consciousness, where you're reverberating at a level that allows you to interact with your reality in a way that's beyond being a radio. So addiction treatment, basically, I've made an argument that it needs to involve biological, energetic, psychological, emotional, social, cultural, and spiritual. And then you have to make the question, we always kind of try to parcelate and fragmentize. Oh, thank you. Give it a name and compartmentalize it. And this is one of the things that I'm working on with a friend of mine, John Norman, who's a professor at Madison, Wisconsin. And we have a video series on YouTube, the Soul Science channel. And we talk about parcellation of the scientific approach and structure and what needs to happen and how to integrate some of these spiritual aspects. So anyone you think that would be interested in that, it's a free explorative educational series that I've just launched for the YouTube channel. So divine alchemy of addiction. The cause and cure for addiction both reside within the drive and need to become whole within oneself through integration and self-transcendence and awareness and consciousness to achieve the natural state of bliss. That is what I have for you today. It's my argument, my thesis. Very simple thesis, right? But I had to build the data up, and then we just funnel it in, try to summarize it, bring it in, bring the cone in. And for any additional resources, visit soulscience.org. It's a coaching site right now, but it's going to be developed into education and outreach. And you can get a hold of me at jordan.blacktop@soulscience.org. And for those additional videos coming up, starting a series, it's been filmed, but I'm going to start releasing them either bi-weekly or weekly for those integrative processing. The education of science and spirituality with the What's Up Doc series, you can find that at the Soul Science channel.